Hello, my name is Diwakar Kinra, and I'm an endodontist in private practice in Flint, Michigan. In our first webcast, we discussed the importance of philosophy, education, and practice lifestyle as we begin our career in dentistry. Now we will continue our journey in the importance of furthering our education beyond what we learn in dental school. As stated before, when we exit dental school, we find ourselves in a bit of a conundrum when it comes to performing endodontic procedures in the early years of our practice. The expectations are to provide a highly technique-sensitive procedure, which happens to be the one thing most students are least prepared for when leaving dental school. No matter what practice philosophy you choose, there will be an expectation, whether realistic or not, to perform quality endodontics. Skills and speed are not up to private practice standard. So what do we do? Let's take a look at endodontics from the patient's perspective. Root canal therapy is one of the most feared procedures in dentistry, with all of the rumors and history involved. And since many of us have minimal training in dental school, it's a feared procedure for us also. So therefore, we may not recommend this procedure to the patient. Because in most cases, we only treatment plan what we are comfortable doing, but in reality, this is an opportunity. All we have to do is beat our patient's expectations by a little bit, meaning just getting above the bar. If we do that, we will exceed their expectations and overcome their fears. And if you do this, they will trust you inherently. Performing a well-done root canal therapy, the patient will go to tell 3 of their friends, and this word-of-mouth advertising can be a real practice builder. You just did a great job on the most feared procedure in dentistry, so they will of course trust you with the rest of their dental work. But doing a bad root canal, they'll go tell 10 of their friends, not the type of reputation building you want in the beginning of your career. You would think that after school that there is no way I want to go back for more CE. Thoughts go through your mind such as, I don't need it, doesn't go towards any requirements in most states, or I can't even afford it. But in reality, your clinical knowledge is minimal and your clinical speed is not sufficient in most cases. Therefore, any additional real-life training will help you further down the path of success. How do you keep abreast on the latest technology when it comes to dentistry? Just like most other technology, there is an adaptation cycle when it comes to current trends in dentistry. I always advise that you be on the leading edge of technology, not the bleeding edge of technology. That means that before you adapt a piece of technology or equipment into your office, you need to do the research, focus on the field, learn the product, technique, or procedure. Adopt into your office and, if possible, practice in vitro first. Then, definitely incorporate it into your patient population. Because it's a waste of time doing the above and then you have the latest and greatest in your office but never utilize it. Therefore, CE helps you get a hold of these previous discussed topics. In most cases, presenters take the time to do most of the research and focus, and it's your job to learn, adopt, and incorporate. Studies show that generalists perform 85% of all root canal therapy. When it comes to root canal therapy, the general dentist is definitely in control. Why is that? Well, GPs get to be in the driver's seat as the gatekeeper, and they get to cherry-pick cases that highlight your skills and abilities. And remember, the patient will be judging you on your ability to perform pain-free endodontics. And if successful, it will help build your practice. And don't forget that a well-done single-visit root canal can be one of the most profitable procedures in dentistry. How do we know what we can treat in the office or needs to be referred to the specialist? I actually like to use this form when making that decision. This is the American Association of Endodontists Case Difficulty Assessment Form. This is a great worksheet to decide whether a case can be handled proficiently in your office or needs the care of a more trained colleague. In this webcast, you'll be provided a link to be able to download this form so you can make copies for your office use. Now, most dentists break each of these categories down into minimally difficult, moderately difficult, and highly difficult. But I like to look at this worksheet a little differently. And some may consider this taboo, but I look at this from the viewpoint of profitability. These are cases that you can make money on. These are cases that you can break even on. And these are cases that you may lose money on. But with proper training, you may be able to upgrade your patient's experience and move up a category and have more cases fall into the more profitable arena. For a more in-depth analysis of each of these categories, please join me in my case selection webinar as I provide free continuing education in how to select the best and most profitable cases for your patients. Thank you so much for allowing me to share this information with you. Join me next time as we discuss underdiagnosed endodontics and how to bring more endodontics into your practice.